name is Dr. Lux and I will perform an examination of your feet today. I understand that you hurt them.
I did, yes.
How did that happen?
So I'm working out now by using a jump rope.
Okay.
And I actually hurt both of my feet while I was skipping. I think I'm taking things a little too far.
And how long ago did that happen?
2 days ago.
2 days. So you fell while jumping rope. Did you hurt anywhere else other than your feet?
No.
So no pain anywhere else? Good. No. On a scale of 1 to 10, in how much pain are you right now?
4.
A 4. Have you taken any medication for this?
I'm just taking acetaminophen every 5 hours.
5 hours. For the last 2 days, every 5 hours. Has that helped in any way?
Yes, I believe it's helped with the swelling.
Have you applied any cold patches or hot patches on the feet?
No.
Okay. And I assume you have not been jumping rope ever since that happened?
Correct.
Good. All right. Let's go ahead and take a look at your feet. I'd like you to lay down with your face that way. Face up. Okay. I'm going to go ahead and sanitize my hands. And is it okay if I remove your socks?
Yes.
Alright, going to start off with just a visual inspection of your legs. Did you happen to hurt your knees in any way?
No.
Okay, so knees are intact. I'm looking for any redness, any blues or purple colors, anything that may indicate any external signs of an injury. And would you say that the top of your feet hurt more or the bottom?
The bottom.
The bottom, okay. All right, inspecting your midfoot, your metatarsals and phalanges. I'm seeing a little injury here on your big toe. Was this as a result of the fall?
Yes.
Okay. No infection. Seems to be healing, okay. Just palpating over your tibia bone. Hind foot and midfoot. The insoles of your feet. Looking for any indentations, any swelling. Can you wiggle them for me? Good. Not seeing any injury in between your toes, other than the one injury over here, which seems to have been bleeding a little bit. Does it hurt when I press down on it?
Not at all.
Okay, so it seems to be healing. Okay, that's good. Okay, I'm going to check your capillary refills. Two seconds. I'm going to palpate around the joints of your toes. Any pain here?
No.
Here?
No.
Good. Okay. Pain here?
No.
Here?
No.
Good. I want you to press down into my palm. Good. And now I'm going to attempt to bring your toes towards me. Don't let me do that. Good. I'm going to attempt to spread your legs apart. Don't let me do that. Good. And bring them together. Don't let me do that. Good. Okay. Going to go ahead and explore the bones of your legs and make sure that there's no fractures, no fissures, nothing concerning the bones. Left tibia bone is intact. I'm going to check the right one as well. Okay, intact as well. Any pain when I do this?
No.
How about when I pull on your leg?
No.
Okay. Any pain when I rotate?
No.
How about when I invert
No.
and evert?
No.
Now can you rotate your foot by yourself and bring it inwards and outwards? Good. Any pain when I do this?
No.
How about when I pull on your leg?
No.
Okay. Checking the calcaneus bone in the back. Any pain when I do this?
No.
Okay. Inversion, eversion, any pain here?
No.
Okay. Now can you rotate your foot? Good. And now I will rotate. Any pain?
No.
Good. going to focus on exploring your metatarsal bones in the mid area of your frontal foot. I'm just going to palpate. Any pain here?
No.
I'm going to gently tap. The metatarsal bones in your right foot are intact. I'm going to check the phalanges as well and tap on them. And do the same check on your left foot. Metatarsals are intact. Checking the phalanges next. Good, intact as well. Good. Next up, I'm going to do a nervous sensory check of the nerves that innervate your legs and your feet. And I'm going to begin by focusing on the sural nerve here in the back. You feel this?
Yes.
Okay. And you feel this?
Yes.
Good. We're going to do a sharp or dull on the sural nerve. Now, is this sharp or dull?
Sharp.
How about this?
Dull.
Good.
Dull.
Good.
Sharp.
Good. And now I'm going to check the saphenous nerve in the inner portion of the foot. Any pain when I'm touching down on it?
No.
Good. And do you feel this?
Yes.
And this?
Yes.
Sharp or dull?
Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Dull.
Good. Next, I'm going to check the superficial peroneal nerve in the front. Any pain when I'm just touching you?
No.
Good. Do you feel this?
Yes.
And this?
Yes.
Do you feel this equally on both of your feet?
Yes.
And how about this equally?
Yes.
Good. Sharp or dull?
Dull. Dull. Sharp. Dull. Sharp. Dull. 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 Dull.
Very good. Next up, I'm going to check the deep perineal nerve right in between your big toe and the second toe. Do you feel me touching on it?
Yes.
Any pain here?
No.
Do you feel this?
Yes.
Is this sharp or dull?
Dull.
Good. What is?
Sharp.
Good.
Sharp. Sharp. Dull. 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 Dull.
Good. Now I'm going to incorporate cold. Do you feel this?
Yes.
And this?
Yes.
Is this sharp, dull, or cold?
Dull. Cold. Dull. Sharp. Cold. Dull. Cold. Dull. Sharp. Cold. Cold. Dull. Cold. Cold. Dull. Dull. Cold. 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 Dull. Cold.
Okay. Next up, I'm going to use a slightly sharper tool, and I'm going to touch you all the way from the top of your knee to your toe, and I want you to tell me when the sensation stops. Do you feel this?
Yes.
Okay, tell me when it stops.
No. 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 No.
Good. We're going to do the same on your underleg. Do you feel this?
Yes.
Tell me when it stops.
No. 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 No.
Good. Feel this?
Yeah.
And this?
Yes.
This.
Yes.
And this.
Yes.
This.
Yes.
This.
Yes. Yes. Yes.
Good. Now I'm going to manipulate your toes And do you feel this?
Yes.
This is up. And do you feel this?
Yes.
This is down. Tell me if I'm moving them up or down.
Up.
Good.
Up. Up. Down. Down. Up. Down. Up. Down. Up. Down. Down. Up. Up. Down. Up. Down.
I'm going to hold down on some of your toes. Can you bring this big toe towards your head? Good. Now can you bring this one towards your head? Good. And push it down. Perfect. Alright. Now try to push into my toes with your big toes. Very good. Push into my fingers with your toes. Good. Push into my fingers. Good. Into my fingers. Into my fingers. Perfect. Okay. Next up, I want you to flip face down so I can inspect the plantar region of your feet. Going to begin by doing an inspection of your calf muscles as well as the plantar region of both of your feet. Looking for that reaction as I'm moving down the plantar region. Good. I am seeing a little dryness and scaling. Some hard calluses around your calcaneus region on your heel. Okay. Toes are reactive to touch. Same on the other foot. Seeing a little bit of a discharge on your right calcaneus region. I'm going to take a sample of this discharge. And we're going to test this out, send it to the lab, and determine if there's any infection that could be emerging in your right foot. Okay. I'm going to explore the plantar region of both of your feet. And you mentioned that this is where the pain is localized, correct?
Yes.
Exploring your calcaneus bone first. Any pain here?
A 2.
Okay. Moving down to the mid-plantar region. Any pain here?
No.
And moving down towards your toes. Any pain here?
No.
Big toe.
Mm-mm.
Okay. Going to explore the same calcaneus region in your right foot. Any pain here?
No.
How about here?
No.
Same too as on the other foot?
Yes.
Okay. So left calcaneus region and right mid-plantar are painful. Any pain on your big toe?
No.
No? Okay. Right, I'm going to test the nerves in your feet next. And I'm going to start with the tibial nerves over in the calcaneus region of your left foot. Do you feel this?
Yes.
And this?
Yes.
Good. And this?
Yes.
And this?
Yes.
Good. Say it softer. Is this sharp or dull?
Dull. Sharp. Dull. Sharp. Sharp.
And now I'm going to incorporate cold. Do you feel this?
Yes. Sharp. Cold. Dull. Cold. Sharp. Dull. Cold. cold, cold, cold.
Next up, I'm going to focus on the medial plantar nerve. Do you feel this?
Yes,
And this?
yes,
Do you feel this?
yes,
And this?
yes.
Does this go left to right or right to left?
Left to right, right to left, right to left, left to right.
Up, down, or down, up?
Down, up, down, down, up, down, up. Cold, 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 cold. Sharp, cold.
Now I'm going to bring in something a little sharper. Do you feel this?
Yes,
And this?
yes,
Good. You feel this?
yes,
And this?
yes.
Good. And where am I touching you now?
Big toe,
And now?
big toe.
Okay, good. Next up, I'm going to focus on the lateral plantar nerve. You feel this?
Yes,
And this?
yes,
Good. Do you feel this?
yes, yes.
Good. Sharp, dull, or cold?
Cold, cold. Dull, sharp, cold, dull, sharp, cold, 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 sharp, dull, cold, cold.
Next up, I'm going to touch you with the tool that has two pinwheels. Do you feel this?
Yes,
This is 2. And do you feel this?
yes.
This is 1. So just say 2 or 1.
2, 1, 2, 1, 2, 2, 2, 2, 1, 1, 1, 1, 1, 1.
Right? Does this hurt?
No,
Okay, now can you rotate the foot? Good. Does this hurt?
no,
How about eversion? Does this hurt?
no,
Flexion? Does
no,
this hurt? Does this hurt?
no.
Okay. internal rotation. Does this hurt?
No.
Now can you rotate the foot? Good. Inversion. Any pain here?
No.
Here?
No.
Flexion?
No. No.
Okay. Right, I'm also going to do the Babinski test. So leave the weight of your foot in my hand. Yep, give me the weight. And I'm going to slide the sharp tip of my medical hammer over the plantar region of your foot. Okay, good. Same test on the other foot. Give me the weight in my hand. Good. Okay. So the pain seems to be localized in the calcaneus region of your left foot and the mid-plantar region of your right. I'm going to go ahead and measure the two and cross-compare. 45. 45.1. 48 at the base. 46 at the base. So a little bit of an inflammation going on over here on your left heel. (62) over the mid-plantar region. 52. So the mid-plantar region is also a little bit inflamed on your left foot. Supraplantar region. 67. Supraplantar region. 66. So I'm seeing a little bit of an inflammation. Do you feel that?
Yes.
And this?
Yes.
And this?
Yes.
And that?
Yes.
Good. That?
Yes.
Good.
Yes.
So no concerns with the nerves in your feet or your legs. I'm seeing a little bit of an inflammation that most likely will go away, muscular. But from a neurological point of view, I don't think we should be concerned unless any other symptoms will emerge over the next couple of days. Okay, you can come back up now. This concludes the examination. I did a very thorough inspection of your legs, your feet. From a neurological point of view, I'm not seeing any nerve damage, which is something that we would be most concerned with. I believe the heels and the bottom of your feet are inflamed because of the fall, and that the problem is muscular. So I suspect it's going to go away in the next couple of days. So rest up, continue taking the medicine, and come back to see me if things don't improve, but they should.
Very good. Well, thank you for your help.
You're most welcome. Do you have any questions for me or anything that you'd want me to help you further with?
No.
All right.